Okay, my name is Louise Flanagan and I am a Registrar in Public Health in NHS Lanarkshire. The World Health Organization describes obesity as a build-up of fat that then leads on to impair your health. The technical definition of obesity is using a measure called the body mass index, or BMI, and being overweight or obese, basically the measure they use is 25, so anyone with a BMI of 25 and above is classified as overweight, anyone with a BMI of 30 and above is classified as obese. And being in this category can lead to health problems such as increasing your risk of coronary heart disease, stroke, type 2 diabetes. It can lead to premature mortality, cancers, a variety of different things. Obesity is quite complex, the reasons behind it, how it develops. There are things that can be done to prevent it, such as physical activity and diet, but it isn't just caused by those individual factors. There are overarching things like the environment that we live in that can increase the risk of obesity and what they describe as an obesogenic environment. So the healthy weight strategy is basically focusing on a number of areas such as healthier food choices, physical activity and the environment, and weight loss interventions as well as surgical interventions as well. The healthier food choices include things such as focusing on early years and young people and making sure that healthier choices are encouraged at an earlier age and habits are developed and then lead on and get carried on into their adult life. And things such as ensuring that takeaways and food outlets are providing healthier choices and not just the fast food, unhealthy choices. Canteens and workplaces to make sure there are healthy choices available for their staff, providing healthier fruit and vegetables at a more affordable price for lower income families who often can't afford to buy fruit and vegetables and can't afford to buy healthier food alternatives. And then also making sure people have more informed choice, so they are both aware of what food is healthier, but then also aware of how to prepare food, how to cook food, rather than just going for the easier option. And also trying to encourage the interest in healthier foods to make sure that people don't just see it as a nuisance and they are more interested in the social interactions around eating with families and the healthier food choices and the benefits they can gain from that. Physical activity, the strategy is focusing on a number of areas as well. These include active travel, so encouraging people to use more physically active routes to work rather than just driving. This can include walking, trying to improve walking routes, making sure there are walking routes available and that they're safe. Encouraging people maybe to get off a bus stop a few stops earlier so they walk a bit further and then increase the number of steps they're doing each day. Encouraging cycling to work and linking in with works to encourage that there are cycle to work schemes, places to store bikes, things like that. Encouraging families to be more physically active, to play with children rather than watching TV at the end of the night, to encourage that physical activity habit and to then that develop into their older life. Looking at healthy ageing, encouraging older groups and older people to start physical activity or to maintain it if they have already been doing that. One of the things the strategy is also looking at is the environment, so green space and open spaces, and research has shown that having access to green spaces increases your overall health but also increases your mental health and your well-being simply by being near one and having access to one, so encouraging areas like that as well. Way to Go is a community weight management programme developed for adults. It's a 10-week programme and it's free and you can self-refer from either North Lanarkshire or South Lanarkshire Leisure. We have a weight loss intervention programme focusing on diet and exercise and health behaviours to look at losing weight over a sustained time period, over a small amount, rather than going for a very drastic weight loss, and then to try and carry that on. Anyone can self-refer. It's included in your North Lanarkshire and South Lanarkshire fees, and the 10-week programme is free. The general health of prisoners in Scotland is often poorer compared to the rest of the population. Quite often prisoners are from a more deprived population and they're less likely to actually have ever come into contact with a health service, a GP or anyone before. Studies into prisoners' health in Scotland have shown that over 70% are likely to have an alcohol problem, a very high proportion are likely to smoke, they often have illegal drug habits, and as a consequence of that often have bloodborne viruses or other infections, and they quite often have mental health problems as well.